Hey guys, before we get into today's video, make sure you guys hit that like button and subscribe. Now, let's get into the topic. So as you can see in the title, there is a nursing shortage, and in case you weren't aware, we're going to discuss why. You may be wondering, how could that be possible when, my cousin, my brother, my aunt, my sister, they're going to nursing school, and then I have other friends going to nursing school. Yeah, there are a lot of people in nursing school, but the amount of people that are in school currently, and then by the time they graduate, we're not going to meet that demand. And part of the reasons are because a lot of the nurses we have right now are baby boomers. So what's that mean? They're getting older, and it's going to be time for them to retire. So that's going to create a drastic decrease or shortage of nurses that we're going to need in the future. The Bureau of Labor Statistics estimates nearly a deficit of 1 million nurses by the year 2022. It is 2020 already. So in about 2 years from now, we're estimating at least 1 million nurses that we're going to be short of. And guys, in times like this, with this whole COVID thing literally just sweeping the world, we are super stressed as it is right now. So by 2022, I can't even imagine what it's going to be like to be short 1 million nurses. My hospital right now is like every single day we're having to pull like travelers and other staffers down to our ICU just to meet the demands just for that night, and this is happening every single night. Our COVID patients, our unit is full. There's a time where we had like 1 or 2, and then we had none. And now we have, just in our ICU alone, we have 20 in our ICU. And I think out of the 20, maybe 18 or 17 of them are on vents. And that's not including our 5th floor med-surg tele-COVID patients. So that alone, we're already struggling. I know many other states are. New York, obviously, is super struggling with all of this. And Arizona, which is where I live, in case you guys didn't know, Arizona's getting hit super hard with all these COVID patients, and obviously that's due to lack of people gowning up. It's due to reopening our economy, a whole bunch of factors, right? So us as a state alone, I know across Arizona, our hospitals were 85% at capacity. So for us to be okay and then just out of nowhere just skyrocket with a drastic amount of patients and having a nursing shortage already, I can't imagine what it's going to be like in 2022. Reckon I don't plan on COVID still being around. I hope there's not another pandemic by that time, but just imagine that if there was. So like I said earlier, there's a lot of people in nursing school right now, but there's only a limited supply of new nurses available. And what that means is there's only so many new nurses entering the workforce each year, but it's not enough to cover the deficit of those retiring. I just want to touch on another problem that I'm seeing is that employers are offering sign-on bonuses or incentives like, hey, come here, hiring travelers here and there. Travelers are, for the most part, temporary fixes. These are all temporary fixes. So it's employers need to invest more into their employees to get them to stay. We want retention rates to be sky high. By having people leave constantly, we're just spending more money, hiring more nurses. If we just invest, we can keep, we can retain, we can have the appropriate amount of staff that we need. And that needs to be across the board for everywhere. It doesn't help when we have nurses going here, and there, all over the place, hopping around, because then you don't have the right amount of nurses to care for the patients. So just another example, my unit, in our COVID unit, we usually have one-to-one assignments or one nurse to 2 patients. But in our non-COVID units, there's been a lot of assignments where, and remember, we're in the ICU, we're only supposed to have 1 or 2 patients. There's been a lot of assignments where nurses are having 3 patients. Now, granted, they have a nurse extender, and what that means is that they have a tele-nurse or a med-surg nurse to help the ICU nurse to take care of these 3 patients. So the nurse extenders, they chart intake and outputs, so the daily activities, daily care stuff, turns. They help with those kind of things. But for the ICU nurse, it's their responsibility to take care of all 3 of those patients. They have to chart their complex assessment. Anything that goes wrong with each one of those 3 is mainly on the ICU nurse. So that's putting a lot more stress on us, which we never expected to deal with. And I personally think I see that. So it's just another thing, we gotta, and it's easier said than done, I know this, but if we just put more effort and energy into our staff, I think that things would be a little bit better. And let's not forget the glorious term nurse burnout. And in case you guys don't know what that means, that basically means you're just tired. You just can't do it anymore. You're tired of doing nursing and you basically just switch and go to a different field. They hit that hard in nursing school and even in the workforce. And I think it's one of those things where how I feel is because in nursing that you can do literally numerous amount of things, there really shouldn't be a burnout. If you've been a med-surg nurse for 10, 15 years and you just this is just getting old and tiring, guess what? You can go to ICU, you can go to cardiac cath lab, and you guys don't have to do bedside nursing anymore either. You can literally get into legal, you can get into forensics, a whole bunch of different aspects of nursing. You can do auditing for pharmacies, stuff like that. You can work at Intel and just take care of the employees there, So I feel like the nursing burnout shouldn't necessarily happen, but in reality, that is one of the things that does happen. So that's another contributing factor to why we have a nursing shortage. Before I wrap up this video, the last topic I want to discuss on why there is a nursing shortage, or a fact that contributes to why there's a nursing shortage, is violence in the healthcare setting. Yes, violence. There is an emotional and physical abuse already adding to a stressful environment. Emergency department nurses and psychiatric nurses are at a higher risk due to their patient population. I know this statistic is a little outdated, but there's a study in 2008 to 2009 in Poland that showed that nurses were the most vulnerable to aggression regarding the healthcare setting. For some of you who may not, already work in healthcare, and you're kind of oh, that's kind of weird. Why would people be violent or aggressive towards nurses? Healthcare is a very interesting thing to me because, and I guess I choose nurses when I'm a nurse, and 2, we're the ones that's taking care of the patient all night and all day, right? So it's one of those things where patients, they get frustrated, if they're in pain and let's say they're maxed on pain medication, or the doctor won't prescribe them a certain medication. The doctor may not be the one doing this or that, right? But we're the ones taking care of that patient. So we're the ones who have to deal with that patient being upset, sad, mad, happy, anything. So a lot of times, if you're in the ED, ICU, you get a lot of people that are detoxing alcohol and drugs. Those patients become extremely aggressive when they are withdrawing. So we're the ones who have to deal with it. And again, it's one of those things, it's well, hey, if you're sick, then it's why are you coming to the hospital and trying to give us a hard time, And a lot of times they might not be in their right mind. Again, they might be high on stuff, but we're the ones who have to deal with it day in and day out. But with that being said, I don't want to scare any of you away who are in nursing school or thinking about doing nursing. That's not the case all the time. It's more common in certain areas of nursing than others. It can be in all areas, of course, but again, that's just another thing to take in mind before you finish your program or before you start nursing. Even while you're in nursing, you just have to take a step back and just be take a breather. You have coworkers, hopefully they're amazing coworkers that can help you with the situation. We do have security, we have all the necessary steps in place, But again, just take in mind, it's not all flowers and happiness every day, day in and day out, okay? People do get violent, and that's something you have to be prepared for. But again, it's not all the time. Just something to take into consideration. So that's about all I have for today's video. Thank you guys so much for watching, and I will see you guys next time.